Well, good morning, everybody. This is Taylor Gardner with Western Marketing. Just want to thank everyone for taking time out of their busy schedules today to hop on this webinar here. We have Trisha Maines with Mutual of Omaha. She's going to be running through the dental vision hearing product that Mutual of Omaha has, and then their brand new hospital indemnity plan that should be rolling out here and not too long. With that, I'm going to go ahead and introduce Trisha and let her take over.
Thanks, Taylor. Hi, everybody. Good morning. Yes, my name is Trisha Maine. I'm a sales manager here at Mutual of Omaha. I manage our senior health products. That is our Medicare supplement, our dental, and coming very soon, our hospital indemnity product. So this morning, as Taylor mentioned, I'm going to be covering our dental vision product, and then I'm going to go very in depth with our hospital indemnity, our hospital protection plan. So I'm going to review those two products. I'll cover base products and then the options available to the clients, so you can really dial in on the best plan design to meet the individual needs. So we'll really dive in this morning on both of those plans. But I'm going to begin with our competitive dental plans first. So really high level here, breakdown of our product. Issue age is 19 to 99. It's a guaranteed issue product. We have two plans available, the preferred plan and the protection plan, which I'll break down here in the coming slides. And then there's zip code rated. So beginning at the top here on the preferred and the protection plan, like I said, their issue ages 19 to 99. On the preferred plan, we've got $0 for preventative services for that calendar year deductible, and then $50 for basic and major services. On that protection plan, we've got $100 to cover all services combined for that calendar year deductible. Taking a look here at the preventative and basic services. So on that preferred plan and the protection plan as well, preventative services are covered at 100%. For those basic services, so we're talking fillings, simple extractions, emergency treatment. On that preferred plan, it's 80-20, and then on that protection plan, it's 50-50. So here's something that that kind of sets us out here. So major services, we cover major services starting at day one. There's no waiting periods for major services. On the preferred plan and the protection plan, day one we cover 20%. After 12 months, it bumps up to 50% here. And another piece of our coverage that does make us stand out and makes us really competitive is our calendar year benefit is up to $5,000. On both of our plans, you can choose between a $1,500, $3,000, or $5,000 calendar year benefit. And then finally, the lifetime max benefit for implants. We do have the competitive $3,000 max on the preferred plan, and then up to $2,000 on the protection plan as well. The preferred plan is by far our most popular plan, just because we offer that $3,000 implant max, $5,000 calendar year benefit, and those two combined make this a really popular plan. We offer our dental plans in every state except for New York and Massachusetts. Our Vision Rider is available in all states except Washington and Maryland. And we also offer our multi-product discount in all states except Washington and Alaska. We are in the Dentamax Plus network, which is a PPO network. The Dentamax Plus network has over 406,000 in-network providers and is in association with the Dentamax United Concordia and Connection Dental networks. Since we're a PPO network, this means we offer negotiated rates. So your customer is going to have lower out-of-pocket costs when they're visiting an in-network dentist. And depending on the state and the service, the negotiated savings can range anywhere from 5 to 55%. PPO dental plans also mean out-of-network benefits as well. So here's how the two plans work and how they coordinate for out-of-network coverage as well. So on that preferred plan, charges are paid to the 80th percentile of the average cost of service in the customer's area, and then the customer pays the difference to the dental provider. And then on that protection plan, the amount Mutual of Omaha pays is limited to the in-network discounted fee schedule, meaning the dentist can then balance bill the difference back to the customer. So regardless of seeing an in-network or out-of-network dentist, it makes sense to have that dental coverage. They're going to receive a discount at some capacity holding this coverage. And then we offer a 15% multi-product discount on the dental coverage as well. So if you sell your customer a Medicare supplement policy and you sell them our dental policy as well, so a Mutual of Omaha Medicare supplement policy and dental policy, they're going to receive the 15% multi-product discount on the dental policy. You have to sell it with the Mutual of Omaha Medicare supplement policy or within 30 days of that MedSup policy. This is to help incentivize your customer. This is a great leveraging point for you as the agent to help you make that additional sell as well. But it does need to be in that 30 days, and then they'll receive that extra 15% on the dental coverage. We do offer an optional vision rider on the dental coverage itself. It does offer up to $50 every calendar year for an eye exam, and then up to $150 every 2 calendar years for glasses or contact lenses. The cost is $8.28 a month. There is no network since it's a reimbursement expense. And then it is not standalone coverage, so it is a rider on the dental coverage itself. We know the success and competitiveness of our product because we've experienced 81% growth year over year in 2024 and continue this growth trajectory in 2025. I do also want to remind you that you can sell this product on its own. In addition to selling it on its own, dental is an excellent cross-sell product. This can be sold across all product lines, whether it's Medicare supplement, ancillary, simplified issue life products, and even Medicare Advantage, as we see dental benefits being cut in the MA space on those Medicare Advantage plans. So please keep our dental plans in mind when you sell any of those other products. Statistically, when you write more than one product with your client, you're increasing your chances of securing that client long-term as being their agent of record. So definitely keep our dental product in mind, especially since we have such a competitive product to offer. If there are no questions on the dental product, I'm going to hop right over to our hospital indemnity. All right, so now that we've taken a look at our dental plans, I do want to transition over to our hospital protection plan that will be coming to our market very soon here. As I stated earlier, I'll be covering details on our optional riders that are going to be available. I'll go over how to submit business, how to file claims, a few sales tips, marketing support, how to get you started, and what states we're going to be initially rolling out in. So with the average cost for a one-day stay in the hospital on the rise, a hospital indemnity plan can help your clients offset expenses and protect them financially, regardless of the healthcare coverage they may already have. Before I share the plan overview, it's important for you to know a few key words. The first is calendar year. So calendar year is the 12-month period of January 1st through December 31st of each year. Next is hospital confinement, which is defined as inpatient at a hospital for at least 24 hours because of a covered injury or sickness. The period of confinement or reset period begins when the insured has been hospital confined and ends when there has been no additional hospital confinement for 60 consecutive days. Lastly is observation stay, which starts at 6 hours. After 24 hours, it's considered hospital confinement. So let's start with a few quick highlights of the plan. Issue ages are 18 to 85. And look at that guaranteed issue window, age 64 to 74. For those applicants not in a guaranteed issue window, our automated underwriting provides you with a quick decision of either issued or declined. Some of your clients may qualify for a 7% household discount. More on that in a bit. Coverage is guaranteed renewable for your clients if your clients continue to pay, if their coverage is, if they pay and coverage is paid, if it's paid on time. There's no client ID card, policy fee, or application fee. And great news, no waiting period for coverage to start. There is a 6-month look-back period for pre-existing conditions. All right, so when you're building out the base benefit for your client, the first choice they need to make during a period of hospital confinement or observation stay. Do they want a daily benefit amount for a certain number of days, or do they prefer a lump sum benefit amount? They select one or the other on the application. Let's look at the daily benefit amount option first. With this selection, they'll choose a daily benefit amount from $100 up to $1,000. You'll also need to dial in the number of days they'd like covered. So either days 3 through 10 or 15 days, 20 days, or 31 days. Using our e-app or mobile quote app, that'll make it easy to calculate the monthly premium. There's a lot of customization available to best meet your client's needs and budget. If they prefer a lump sum covered benefit for their covered hospital confinement or observation stay, on the application, you'll select the lump sum, and then that's ranging from $100 up to $3,000, and you can choose that in $50 increments. Built into the base plan, there are a few additional benefits, starting with the observation stay. The base plan pays 100% of the daily benefit amount selected for the lesser of 5 days or the base hospital option selected. A few additional items to note regarding the observation stay. There's no period of confinement like there is for the daily hospital confinement benefit. An observation stay does not stack with the daily hospital confinement benefit. And if your client selected a lump sum benefit option, if a benefit is paid for an observation stay, that uses the benefit for the year. If they have an inpatient hospital stay later in the year, there's no benefit available. The next built-in benefit is an inpatient mental or nervous disorder benefit. This pays $175 per day up to 7 days per calendar year. And then the last built-in benefit is for pet boarding. So this pays $75 per day up to 14 days per calendar year when the insured is hospital confined and they need temporary boarding at a licensed facility for their pet. When your clients purchase a hospital indemnity plan with Mutual of Omaha, they also receive a few value adds at no additional cost. So those are going to include our iMed value add, which provides discounts on eye exams, eyeglasses, and contact lenses when they go to a participating provider. Amplifon, which provides discounts on hearing tests and other valuable hearing services. Garmin, a Garmin discount on watches and fitness trackers. AlloCare, which offers discounts on advanced voice-activated in-home medical alert communication systems. And lastly, ScriptSave RX, which is our newest value add, and that provides savings on prescriptions and medication management tools. So these are optional riders. Because your clients have unique needs, several option riders are available so they can expand their coverage. And I'm going to take a look at each one of these we're going to dive into. First up's the guaranteed purchase option rider, which allows your client to increase their daily benefit amount by 15% after the first policy anniversary. They may elect to increase their daily benefit up to 5 separate times over the life of the policy or to age 85, whichever comes first. The additional base benefit premium is based on the original issue age of the policy and no additional underwriting is required. If the rider is canceled, the daily benefit amount reverts to the original benefit amount and the premiums reduced to the original benefit amount. So let's look at an example. Your client elects to add the GPO rider to their hospital indemnity plan. Coverage is effective on August 1st. In July of the next year, they notify us to exercise their guaranteed purchase option. On August 1st, their new daily benefit is $575. They can elect to exercise the guaranteed purchase option up to 4 more times until the age of 85. Taking a look here at the lump sum cancer rider now. With medical advances, more people are recovering from cancer than ever before. But the cost of care can be overwhelming and can create financial burden. Our rider pays a lump sum benefit to help offset expenses and protect clients financially. Your client elects the lump sum benefit amount they'd like. They can choose from $2,500, $5,000, $10,000, $15,000, $20,000, or $25,000. The lump sum cancer benefit rider pays out when the insured has a first ever cancer diagnosis. In addition to the lump sum benefit option, the rider includes a one-time payment of $600 if your client is ever diagnosed with skin cancer. The rider is underwritten with health questions. There's a 30-day waiting period. The rider ends once the lump sum benefits are paid. So here's an example of that cancer rider. On February 1st, your client is issued a hospital indemnity plan in which they added the $25,000 lump sum rider. And then on March 15th, they're diagnosed with their first ever internal cancer. Barring any pre-existing conditions, the rider would pay the lump sum benefit of $25,000 directly to the client to use as they choose. If sometime in the future they were diagnosed with skin cancer, the rider would then pay an additional $600. At that time, as both lump sum benefits are paid, the rider would then end. And then looking at the prescription drug rider, this rider reimburses $15 for generic and $30 for brand name prescriptions. Clients select either a $250 or $500 max benefit per calendar year. Reimbursement is available until the annual calendar year max benefit amount is reached. In this example, your client elects to add the optional prescription drug rider to their hospital indemnity plan. Coverage is effective January 1. Throughout the year, they submit claims for 32 generic prescription drugs, and they're reimbursed $480. In December of that calendar year, they submit a claim for the brand name prescription. The reimbursement, the amount reimbursed is $20 as they would have reached their $500 annual max benefit. The prescription drug reimbursement process is relatively easy. The policyholder submits pharmacy receipts and we reimburse the policyholder directly. An explanation of benefits from a Medicare Part Medicare Part D is also acceptable proof for reimbursement as well. This rider can supplement standalone Medicare Part D, but the rider is not connected to PDP coverage and should not be marketed as a PDP replacement. And you're also not required to have any sort of AHIP or product training to sell this rider as well. Moving along to the skilled nursing facility rider. So after an inpatient hospital stay or observation stay, some clients may need continued care and recovery in a skilled nursing facility, especially for your Medicare age clients. A covered hospital stay of at least 2 days is needed to qualify for benefits and care in a skilled nursing facility. It must begin within 30 days of the hospital discharge. The benefit period ends with 60 consecutive days. If not being confined in a hospital or skilled nursing facility, then the daily benefit resets. So your client selects a daily benefit amount from $100 to $500. They also need to choose which days to cover per confinement with 3 options available. So days 1 through 20, 21 through 100, or days 1 through 100. So in this example, your client elects a $250 daily benefit amount, and depending on the day's options, it will determine if there's an elimination period that needs to be satisfied before a benefit pays. So there's 3 examples there for 1 through 20, up to days 1 through 100. And then moving on to home healthcare rider. The home healthcare rider provides a daily benefit to help cover the care and assistance your clients may need to recuperate at home. So after an inpatient hospital stay or care in a skilled nursing facility, clients who return home may need help with bathing, dressing, eating, other activities of daily living. Home healthcare means care received in your home and provided by a home healthcare agency. So to receive benefits requires 2 days of a covered hospital stay or skilled nursing facility confinement, and an insured must have a cognitive impairment or inability to perform 2 of the 6 ADLs. The insured's condition must be certified by a licensed healthcare practitioner. The home health care must begin within 30 days of the hospital or skilled nursing facility discharge as well. Your client will need to elect a daily benefit amount from $50 up to $250, and that's in $10 increments. And then the insureds collect benefits for up to 30 home healthcare visits per calendar year. And then the daily activities include the following on the list. And moving on to ambulance and emergency or urgent care rider. With the ambulance and emergency or urgent care rider, your client selects a benefit between $100 to $500, and that's in $100 increments. Each benefit, ambulance, emergency room, and urgent care, is payable 4 times per calendar year. Ambulance is ground, which may include water ambulance, and air ambulance total, not 4 ground plus 4 air. It's 4 total. Urgent care is paid out 50% of the chosen benefit amount. Air ambulance is paid out 10 times the chosen benefit amount. Ambulance and ER benefit can be payable on the same day. So in this example, your client selects a $100 rider benefit effective January 1. On January 3rd, they submit a claim for the ground ambulance. The rider pays $100. They have 3 ambulance rides left for the year. February 5th, they submit a claim for air ambulance. The rider pays $1,000 and they have 2 ambulance rides left for the year. On March 1st, they submit a claim for urgent care. The rider pays $50 and they have 3 urgent care visits left for the year. And then April 3rd, they submit a claim for an emergency room visit. Rider pays $100 and then they have 3 emergency room visits left for the year. Outpatient surgery rider provides an additional benefit to help cover the cost of surgery received in an ambulatory surgical center or outpatient hospital facility. They can choose between $250, $575, $750, or $1,000 benefit. There's no waiting period. Coverage starts as soon as the rider is issued. Benefits are paid for the maximum of 2 outpatient surgeries per calendar year. There's no benefit reset period. Only 1 payment per day, even if there are more than 1 surgeries per day. Documentation from the surgical center or outpatient hospital facility is required for the benefit to pay. We've got the outpatient therapy rider. The client selects a daily benefit from $50 to $250. They also select if they would prefer 15 or 30 days per calendar year. There's a chiropractic benefit of 5 days per calendar year. That's automatically included. The benefit is paid once per day, even if multiple therapy sessions occur. And the benefit is paid for therapy sessions in an outpatient setting, not in a home setting. And here's an example of this. So your client's elected 15 days per calendar year at $200 per day for the outpatient therapy rider. Due to a leg injury, their doctor recommends to see a physical therapist once a week for 4 months. August, they have their first 4 sessions. They continue with sessions 5 through 12 through October. Each session pays a $200 benefit. In November, they have 3 sessions left, which pay a $200 benefit each. And then the last session 16 does not pay a benefit as they have met their 15 days per calendar year max. And then we've got major diagnostic testing. So major diagnostic testing provides a benefit to help pay the cost for major diagnostic testing, which can be substantial. Clients choose from a range of $100 to $500, $100 increments there. There's no waiting period, so that starts as soon as the rider is issued. Benefits are paid for a maximum of 2 diagnostic tests per calendar year, and there's no benefit reset period. Insured can receive both tests on the same day, and then we just need documentation from the hospital or medical provider for the benefit to pay. And here is a list of the covered tests. All right, so now that you're filled in on the product and rider details, we'll go over the underwriting really quick and application processes. Outside of the GI issue ages of 64 to 74, applicants need to answer 2 health questions. First one is, within the past 5 years, have you been advised by a medical professional to have any medical test, treatment, therapy, or surgery that has not been performed yet? This does include appointments that have been scheduled. And then the second question is, do you have any pending test results? This includes test results from routine procedures such as mammogram, Pap test, colonoscopies, or PSA tests. If your client's adding the lump sum cancer rider, there are a few additional questions. I'll give you a second here to read those 3. And then that 7% household discount, we're coming back to that here. So 7% household discount is available at the time of the application if a household member either has an existing household indemnity policy with us or is applying for a hospital for coverage with Mutual of Omaha. So 2 individuals in the same household or a spouse in the household needs to be holding a hospital indemnity product with Mutual of Omaha for each individual to qualify for that household 7% household discount on the hospital indemnity product. Premium structure, the premiums are unisex, so they do not vary by gender. They are based on the applicant issue age, meaning premiums stay the same as they get older. Rates do not vary by tobacco or non-tobacco. Rates vary by state. So as I just went over that 7% household discount is available for qualified individuals. There's no policy fee, no app fee. Initial premiums are due with the app. Can be paid by automatic bank withdrawal or credit card. Ongoing renewal premiums can be made by automatic bank draft, direct bill, either quarterly, semi-annually, or annually. Quoting, a lot of benefit options to choose from. Quoting's easy through our e-app in Sales Professional Access or our phone, our mobile quote tool, which is amazing as well. I'll give you a second here to take a look at some sample rates. So rates vary by age, like I said, discount, benefit options, and state. This sample is showing monthly premiums here. And so this is how you submit an application. You'll use the Sales Professional Access. This is where you can locate our e-app. We're going to jump over into how to submit a claim here really quick. So step 1 here, so you'll obtain the UB04 hospital billing form from the hospital or the facility, from their billing department. Those forms include revenue codes, procedure codes, diagnostic codes, admission and discharge summaries, and all of the information that we need. Then step 2, the insured needs to provide their policy number, name, birthday, address, phone number, and current email address. Once your client has all that information documentation ready to submit a claim, they can do so by either calling customer service, they can email it to the email address on the screen, they can mail it in to us, or they can fax it. And Western Marketing will have all of this information as well. Okay, so now that we've gone over all of the product and rider details, I'm gonna go breeze over some sales tips and marketing materials here really quick. So for some Medicare eligible clients and Medicare Advantage plan, this is your best budget option for their healthcare needs. Medicare Advantage plans typically have copays associated for healthcare services. You can help fill the gaps for those copays in a hospital indemnity plan. So once you've secured a scope of appointment with HIP elected as the topic of discussion, start the conversation about how HIP can help offset copays. Let's look at an example here. So based on your client's Medicare Advantage plan, summary of benefits, they have a $325 inpatient hospital copay for days 1 through 6. You could recommend a HIP-based plan that pays a direct benefit to your client if they are hospital confined for $350 a day for 7 days. If they have a concern regarding emergency care and ambulance rides, the ambulance and emergency care, urgent care would be a great solution. For less than $34 a month, they'd be able to protect themselves against more high dollar copays and concerns. Let's say you have a client that would prefer a Med Sup plan. So they indicate to you that they would prefer a lower monthly premium and they're not concerned with paying a deductible before benefits pay, as they're coming off of a high deductible employer plan already. And they elect for that high deductible Plan G, Mutual of Omaha Med Sup coverage. With the monthly premium savings they're incurring over a regular Med Sup Plan G, they elect to also purchase a hospital indemnity plan. They elect to go with a $3,000 lump sum base benefit plan. For added peace of mind, they also add that $10,000 lump sum cancer rider because they take a handful of generic prescriptions. They also add in that $500 prescription drug rider as well. So while this webinar is a great source of information, we have a few other agent training materials available, including a hospital protection plan flyer and product guide. Both will be available out on SPA. I did provide the flyer over to Western Marketing as well, so that they can provide that to you. And I can provide that to you as well if you need it. We will also have, so all of the rider information that I went through, we are going to have those rider flyers available out on Sales Professional Access under Forms and Materials as well, so that you'll be able to have all of that accessed, that example information and all of that breakdown information available to you as well. To assist with the sales process, an approved consumer point of sale brochure will also be available to you. Again, that's also going to be available out in Forms and Materials out on Sales Professional Access. We'll also have a prospecting letter that you can use to mail out, and then information on the claims process as well. And then check out our social media hub. We do have other posts available for our other senior health products, but we will be adding our hospital indemnity product out there, so you can use our consumer approved social media posts to post out on your social media pages. So now that we've gone over all the ins and outs, one update that we are very excited about on our mutual sales leaders that we made is that we are now implementing you will accrue production credits for hospital indemnity as well as Medicare supplement and dental. So once this rolls out, you will be receiving production credits for hospital indemnity, full production credit, in addition to Medicare supplement and dental as well. So that will go towards your 250,000 production credits to qualify for Rome next year. So we're very excited about that. I do want to highlight something very quickly here on contracting. So if you have an active Med Sup appointment with Mutual of Omaha, we are automatically going to set you up. You will be directed to Western Marketing if you have any questions on contracting or anything like that. So it's already all been set up. You don't need to submit anything additional to us. That once hospital indemnity goes live, if you already are contracted with us for health products, for Medicare supplement products, you can already submit applications to us. Just want to go over a couple of things here really quick, since we went through a lot of information here. So just to recap, issue ages 18 to 85, guaranteed issue 64 to 74, automated underwriting with our e-app makes it easy for you to write business. We've got that 7% household discount when both people in the house are have a hospital indemnity policy with us. No policy fee, no app fee. Mutual of Omaha is known for our broker community, for having excellent broker experience. This product will follow suit from ease of underwriting, ease of quoting, application processing. Think of us when there's the need for your client to apply for a hospital indemnity plan. You'll be rewarded when you do with our competitiveness, our compensation, our amazing agent incentive trips. We're here to make you successful. If you've sold Mutual of Omaha in the past, you know that we have a reputation for outstanding customer service, and we want to take care of your customers. That'll be no different for our hospital indemnity customers. Not only do they have, not only will they get a great product that's been well developed to meet their needs and budget from a company they know and trust, they also have access to our amazing customer service team, which is based out of Omaha, Nebraska, and will be located in our home office. Our customer service associates can help policyholders file a claim, answer questions that they may have regarding their coverage. And they have online access to our policy details via customer access website as well. So as I bring this to a close, if you have additional questions, please reach out to our sales support team. They have an average speed to answer of 30 seconds. So give them a call, send them an email. They are the heart of our exceptional broker experience. These are the states in dark blue that we are going to roll out with initially. This is an ever-changing map. We've added Ohio to this map just on Friday. So next time you see this map, the Ohio will be dark blue, but the dark blue states are the ones that we are rolling out live with. So thanks again for your time. My name is Trisha Main. My information is there on the screen if you need it. If you need anything at all, please feel free to reach out, and thank you so much for your time.
Awesome. Well, thank you, Trisha. Everyone, I think most of you guys are probably already set up with us. So should be pretty easy as far as contracting goes. If you're already in our insurance-based system, just let your marketer know that you're interested in getting set up and we can get this moving for you. I'm not seeing any questions that weren't answered. So after this webinar ends, feel free to give myself a call or one of our other marketers here a call. More than happy to get you set up so you're up and running for when this rolls out here. Once again, our phone number is going to be 800-852-7152. Thanks, everyone.
Thank you.